Mental health is complex, but understanding it shouldn't feel impossible. Whether you're trying to make sense of your own mind or better support someone you care about, knowing the basics can make all the difference. In this video, we're going to walk through every major mental health disorder category. What they are, how they show up, and what they don't mean. No stigma, just clear explanations to help you connect the dots. Number 1. Anxiety disorders. These include generalized anxiety disorder, panic disorder, phobias, and social anxiety. People with anxiety disorders experience excessive fear or worry, often about things others might see as minor. But to them, the danger feels real. It can cause racing thoughts, heart palpitations, nausea, or even full-blown panic attacks. It's not just stress. It's a nervous system that feels constantly under threat. Number 2. Mood disorders. Mood disorders affect emotional regulation. These include major depressive disorder, bipolar disorder, and persistent depressive disorder. With depression, a person might feel numb, hopeless, or chronically tired, not just sad, but emotionally shut down. Bipolar disorder involves extreme mood swings between emotional lows, depression, and highs, mania or hypomania, which can feel euphoric or reckless. These are not personality flaws. They are brain-based conditions that affect energy, sleep, motivation, and even decision-making. Number 3. Trauma and stressor-related disorders. Trauma can change the way your brain sees the world. Disorders in this category include post-traumatic stress disorder, acute stress disorder, and adjustment disorders. PTSD can develop after experiencing or witnessing life-threatening events. Symptoms include flashbacks, nightmares, emotional numbness, and hypervigilance. The brain remains on high alert, trying to protect the person from being hurt again, even when the danger has passed. These are real physical responses to trauma, not signs of weakness. Number 4. Obsessive-compulsive and related disorders. These include obsessive-compulsive disorder, body dysmorphic disorder, hoarding disorder, and others. OCD is often misunderstood. It's not just about being neat, it's about intrusive thoughts, obsessions, that cause distress and repetitive behaviors, compulsions, performed to reduce that anxiety. For example, someone might wash their hands repeatedly not out of habit, but because their brain is convinced something bad will happen if they don't. These cycles can become exhausting and deeply disruptive. Number 5. Personality disorders. This group includes conditions like borderline personality disorder, narcissistic personality disorder, avoidant personality disorder, and more. These are patterns of thinking, feeling, and behaving that are deeply rooted and usually begin in adolescence. For example, borderline personality disorder involves intense emotional swings, fear of abandonment, and difficulty with self-image and relationships. These disorders aren't about being difficult. They often come from early trauma and emotional instability. Number 6. Psychotic disorders. This category includes schizophrenia and related disorders. These involve distorted thinking and perception, such as hallucinations, seeing or hearing things that aren't there, and delusions, strong beliefs not grounded in reality. Schizophrenia doesn't mean someone is violent or has multiple personalities. That's a myth. It means their brain is struggling to interpret reality accurately, and treatment is not only possible, but often life-changing. Number 7. Eating disorders. Anorexia nervosa, bulimia nervosa, and binge eating disorder fall under this group. These aren't just about food or body image. They're deeply connected to control, self-worth, and emotional distress. Eating disorders have the highest mortality rate of any mental health condition and need serious, compassionate treatment. Recovery is absolutely possible with the right support, but it requires understanding both the psychological and physical sides of the illness. Number 8. Neurodevelopmental disorders. These typically begin in childhood and include attention deficit/hyperactivity disorder, autism spectrum disorder, and learning disorders. ADHD involves trouble with focus, impulsivity, or hyperactivity. Autism spectrum disorder affects communication, social interaction, and sensory processing. These conditions aren't about intelligence. In fact, many individuals are incredibly gifted. But they do require understanding, structure, and support. Number 9. Substance-related and addictive disorders. Addiction is not a choice or a moral failure. It's a disorder involving the brain's reward system. whether it's alcohol, drugs, gambling, or other addictive behaviors. People struggle because their brains begin to depend on the behavior to feel normal. It can hijack priorities, relationships, and health. But like all mental health disorders, recovery is possible. Support, therapy, and medical treatment can help rewire those pathways and lead to long-term healing. Mental health conditions don't define someone. They're part of the story, not the whole story. And behind every diagnosis is a person, trying, surviving, growing. If you saw yourself in any of these categories today, know this. You are not alone, and help exists. The more we learn, the more we break stigma. The more we understand, the more we build empathy. And the more we talk about mental health, the more we give people permission to heal. If you found this video helpful, be sure to give it a like, subscribe, and share it with someone who might benefit from it. Be sure to check out our other mental health education videos.